Hey guys, it's Josh from TrustDrivenCare.
And I'm Rebecca with Better Doctor Project.
Good to see you, Rebecca.
You
Hey,
too.
Rebecca, I want to talk today about some struggles that I know I've had in the past and some other doctors. So you deliver great care on the table, and then you assign some active care, right? Some rehab, and the person might not do it, right? Yeah. So I don't know. Have you ever run into that challenge yourself?
All the time. It's so easy because a lot of people need these exercises and then we give it to them and then it's very easy to forget to follow up and check in with them to see how it's going.
Absolutely. And I think it matters too because I think the rehab is really about self empowerment and getting away from that fragile kind of thought process in patients. So I really want them. I always say like sweat glands are pain relievers. If they can lift heavy weights and really work their butts off, their outcomes are so much better.
Yeah, I think so too. And I think it would be pretty amazing if we had some kind of software out there that would let us schedule something a couple weeks out after we've given them the exercises, like a check in. Hey, Bob, how are your exercises going? We started them 2 weeks ago. Have you had any issues? Do you need any modifications? What if we could schedule that in advance? What do you think?
Well, I love that, and I've got great news. We've got a software that does just that. I know that was a total plant, but you know, let's before we talk about the software though, let's talk about has this problem ever come up? I know you were talking about some research you wanted to share about the subject. So what do you know?
Yeah, this stuff is really important, guys. So, research has shown we actually have a great article titled Physician Communication and Patient Adherence to Treatment, which was a meta analysis. They took a look at this and they found, after looking at over 120 different articles, that there's a 19% higher risk of non adherence among providers that didn't have good communication skills. On the flip side, if we are able to train providers to have better communication skills, you're looking at 1 to 1.62 times better likelihood to have better patient adherence. What does adherence mean?
I always love these words in research like adherence and compliance, right? They sound like computer words. But really, what does it mean is that person doing the active care that will give them long-term relief and make them more resilient and stronger and ability to resist future injury. How do we do that? So you said 20% or 19% increase in doctors or providers that had good communication skills. So another way to say that is if your communication skills aren't great, one out of every five are not going to do their homework just because you didn't communicate it. Could be a great exercise, the absolute right diagnosis. They could have appreciated your care. You could have brought them a lot of relief, but just from your failure to communicate properly, one of every out of every five is going to fall off. That's crazy, right?
It's a
Yeah.
really high percentage, and you want to make sure that you're intersecting this from the beginning of the patient care, establishing that trust. I always
Yeah.
recommend people put yourself in the patient's shoes. If you started a particular treatment plan or something with a provider and you didn't trust them, why would you follow with their recommendations? You're going to
Right.
start looking for another provider.
Yeah. And the other thing that we have to like put yourself in their shoes, they came into your office at say 10:30 a.m. and they left at 11. Well, what happened to them at 11:15 and 11:45? Maybe they had a sick kid they had to pick up from school. So just the remembering the exercises, right? Just, oh my gosh, what did she tell me to do? A bird dog exercise, something very simple to us is getting filed away with everything I have to do today. So sending a message later just as a reminder would go so far to just honor the fact that people don't just come see us and then have nothing else going on during the day. We are one of 20 things they might be doing that day, right?
Yeah, reminders are huge. And now we live in a world where you can schedule things. So it doesn't mean that you have to
Mm.
carve out an hour of your schedule every single day to contact your patients. You can see them,
Right.
and while it's fresh in their brain and yours, you can immediately type up that automated message to go out whenever you choose.
Yeah. Now let's talk about the power of delaying that message because I think that's, with your iPhone and whatnot, it's great for texting, but the power of that delay or scheduling when that goes out is so huge that I think people might overlook its power. So the example I always use, we have a client named Reed, and he was saying that he was sitting on the couch watching a movie with his wife or something, and all of a sudden he got this text from a woman that says, "Oh my gosh, thank you so much! I can't believe you remembered. You're the best. You're amazing." And so his wife is like, what's going on? And he couldn't figure it out. And then he remembered that his patient was running a marathon and she had mentioned it 6 weeks earlier. So at that time, he came out of that visit and said, hey, I hope your race went well, and scheduled it for the afternoon of her race day. So when Reed was sitting on the couch with his wife and he had long forgotten about his patient and that she was running a marathon, she gets the message and just blows up excitedly going, oh my gosh, I can't believe my chiropractor remembered this. That is so special.
How much time does it take to do that as a provider? You're showing that
Right.
you care. It's not taking a huge chunk out of your day, and you're
Right.
creating a relationship with that person right from the start.
Absolutely. Can you think of some other times that scheduling that message to go out later, maybe it's not 6 weeks, but other times you see some power there?
Yeah, my favorite time to schedule a message is actually around someone's due date or when they have a scheduled induction date. So a pregnant patient. For
Okay.
example, sometimes getting toward the end of care, I'll know like so and so is scheduled to be induced on February 12th, or maybe their C-section is scheduled for a certain date. I can schedule something either after that date, like a hey, just checking in, congratulations, or you can do so on that day. Hey, we're thinking about you today. Keep it simple. There's a lot of different ways you can get involved with that, especially with the pregnant population or any kind of event that has a date to it.
I love that. I absolutely love that. All right. Yeah. I can think even the delay. So if you see a new patient at 9 a.m, delaying a message to send out just that evening saying, hey, I just want to check in and see how you're doing. Right. We're only talking a few hours delay. And they think, oh my gosh, that person I saw this morning is still thinking about me. Yeah. So I think that just builds that trust early on at the very front end of the relationship. And some people might be like, well, I don't know if I want to send that. What if they respond? And I think that's the best, that's the absolute best situation that can happen. Yes, they might respond. And you know what? As soon as you respond to their reply, all that happens is trust starts building up. That's it. So I would try and create a message where people have to respond because then they feel like you're listening, you heard them, and you're continuing to honor them as a patient, which what's better than that?
Literally nothing. It's
Yeah.
so important. It can make or break your practice.
Now, obviously, this will significantly increase, the likelihood of that person giving you a great Google review. It'll increase referrals. Let me talk about one point you brought up. I didn't want to skip over. You said that training in that same study, they said training physicians has a positive outcome. I can't remember the numbers you used. Can you tell us that again?
Yeah. So my favorite part about the study is that if you take these physicians and providers and provide them with communication training, they are 1.62 times likely to have increased patient adherence. So that proves that communication skills and training is essential in your practice. It should be regularly done for
Wow.
your entire team.
So just training them and discussing something as simple as communication. We're not adding in an expensive diagnostic equipment like a X-ray or ultrasound. We're not going through a weekend seminar on how to provide the best rehab or best active care exercises. All we're doing is saying, take your current skill set and let's just deliver it through better words and body language and messaging, and we're going to get better adherence.
Exactly.
Yeah. I mean, you think about it, like some medications, if they could get a 1.62 times response, they'd be over the moon, right? It would be like the
Yeah.
best new medication ever. And here we're saying, yeah, we can get it just by changing the way we act and communicate as physicians.
And my favorite part about this is that it is trainable. So for someone who, knows that they might not be on the upper end of the skill level, it's really good to see this research and know this is something you can make a dent in and totally transform your practice just by adding some new education.
Which, just so it's not intimidating to people, could be just taking a lunch hour on a Wednesday once a month and just talking about words to use. Or something I love is just analogies, like sometimes we use analogies that are a little too simplistic or they're too complicated for certain patients, or you use an analogy for a while that doesn't work anymore because maybe the product that you're saying it's like this, and people are now like, I don't know about that product, like it brings up some bad memories. So I think that's fantastic. 1.62 times improvement, man. That's huge. That's statistically significant, as my college professor would say. Right?
Yes.
Well, any other tips about getting patients to be, adhere to their active care plan or actually do the exercise we know will help them?
I think just remembering that it starts at that first visit right from the get-go. get your automated messages, establish trust from that very first visit. That way they fully know that you're the provider that they want to have. They're far more likely to listen to you and follow those recommendations.
I love it. All right. Well, once again, Rebecca, turns out communication matters. If communication matters to you in your office and you want 4 times as many reviews and twice as many referrals, then go check out TrustDrivenCare.com. Thanks, Rebecca.
Thanks, Josh.